Now, I would like to start with a type of parasitic infections containing of multiple cells. So multiple cells. So if you think we can divide the parasites to protozoan containing of one cell and metazoan with millions of cells called worms, or in terms of medical science we say helminths. So we are talking about helminth infections in this session, and as you should know, the helminths are divided in groups of nematodes, trematodes, cestodes, acanthocephalan, and maybe pentastomes. But as a point, the important point is that I emphasize on some of the most important of them in according to their public health importance. So let's start with platyhelminths. First, trematodes. All trematodes except one genus that I will talk about that next session are hermaphrodite, and the both male and female organelles are in one individual. So for trematodes, is a class within the phyla platyhelminths. It includes two groups of parasitic flatworms known as flukes, intestinal flukes or blood flukes. So for the first, we start with Fasciola hepatica, the fluke of liver, and it's very important parasite of mollusks and vertebrate. What does it mean? It means that these parasitic infections are zoonotic one, and they are in the life cycle of these parasites. You have to see that vertebrates and invertebrates, intermediate host and final host are involved. So, okay. For trematodes, you can see here, dorso-ventrally flattened, like leaf-like parasites. That one. And unsegmented, despite of cestodes, other type of platyhelminths are segmented one. And hermaphrodite, and also except blood flukes. I told you that we have one exception for blood flukes, schistosoma genus, and diverse species. For two radially striated suckers, so we have oral sucker in them and ventral sucker. Also, incomplete digestive tract. In the platyhelminths, you cannot find digestive tract, and the skin, called as tegument, plays as the digestive tract. For most of the body is occupied by reproductive organs. So this is just the general information about the platyhelminths. So let's start with Fasciola. Fasciola hepatica and Fasciola gigantica, the cousin agent of fascioliasis. Fascioliasis. So in terms of morphology, please pay attention that the leaf-like parasite is very apparent here in picture. You can see that these two pictures are the fasciola in real appearance, and when you go to the slaughterhouses, for instance, you get these worms like cattle, sheep, and other slaughtered herbivore slaughtered animals. You can find very easy with this feature. Anyhow, the left one is Fasciola hepatica, and the larger one in the right part is Fasciola gigantica. So you can see here that the oral sucker, ventral sucker, this is genital core and also uterus, and you can see here ceca. This is not a real digestive tract, but you can find it here, the testis and also ootype, seminal receptacle, and all male and female organs, they are in one individual. Okay. The eggs, like this, they have opercle. The size of the worm is, the adult worm is nearly 2-3 centimeters in length. So for the eggs, you can see that the length is about 130 to 145 micrometer. It's very important because the technician, or all of you, by the first observation, microscopic observation, you will never forget the egg, and also you can definitely find the positive case when you are looking in the stool examination. Anyhow, and this is the natural appearance of the worm on the surface of the cutted liver. So before going further, let me tell you that this parasitic infection, as I told you, is zoonotic, common between human and animals. And since decades ago, they believed that this parasitic infection is just veterinary importance, but after by receiving the record human infection in plenty of places in different regions in the world, now we can see that this is a real zoonotic infection in South America, for instance, in Peru and in Bolivia. We can see that nearly 80 to 90% of people are infected with this parasite. In Nigeria, for instance, or in Burkina Faso, in Burkina Faso, we had a joint project with Spanish researchers over there, and they can find in Burkina Faso 100% in some villages at the same time with other parasitic infections are infected with Parasitology. What's the matter in other countries, in our countries? In Iran, until the earthquake we had in northern Iran around 33, 34 years ago, it was just a veterinary important matter. But suddenly, in Bandar Anzali and in Gilan province, infectionists and other colleagues, they faced to number of increasing patients for such clinical signs and symptoms, and they finally diagnosed as fasciitis. At that time, I remember that nearly 10,000 or more, nearly 20,000 people were found infected. And at that time, we had not access to the treatment, because until that time, it was not a public health importance. So the treatment and drugs was not available and designed. So the physicians decided to use the veterinary drugs like I forgot the name, and they decided to treat the people. So this is.
Did they success? Did they success?
Yes. No, under the very hard supervision. I remember the name of some infectionist, who is now in Tehran, Dr. Asmar, and my professor, Dr. Masoud. They decided to look very precisely for such treatment, and the essential matter, the essential material of this drugs, Fansidar, I think. It was something that now it's designed as praziquantel. So praziquantel nowadays is available, and this is very important to under the supervision of WHO at somewhere. Now, this just I want to mention it. This is not a core of our class. Forget something like that. Anyhow, the important was that after this outbreak and this epidemic, we again witnessed 7 or 10 years later on in Mazandaran province. Nowadays, it is known as a sporadic but endemic parasitic infection in Iran. 2 months ago, 3 months ago, again we witnessed nearly 100 cases suspected to fastidiosis in northern Iran. I had traveled to this area and I talked with the health politicians over there and health workers, and also in their centers we witnessed some records. Okay, what is the situation in other countries? In India, this is completely endemic and you can find cases even in Kashmir. In Pakistan as well. In Iraq, 100%. And I'm surely, let me tell you that according to my understanding, no places, no country in Middle East, in Africa can found free from fastidiosis. In terms of veterinary importance, 100%. Nowadays in Iran, for instance, because of the regular treatment of veterinary sections for cattle and sheep and others, okay, the prevalence of infection is declined. But for human cases, this is not something that if you find Fastidiosis hepatica positive case, it was a very easy trick to go to the laboratory and ask who was the patient. No, then maybe during a year, you can find one case in some area in Iraq. So this is what is really happening. I remember that 10 years ago, when the PhD students and MSc students was with me and for field study in Ardabil province, northwest, in Bandar Abbas, near us here, or in Kurdistan province as well. One day of this field study was going to the slaughterhouses, planned to going to visit the slaughterhouses and to visit which type of parasite we can find. So let me assure you that nearly 10 years ago, nearly 60% of the slaughter animals were seen infected with Fastidiosis hepatica and Fastidiosis gigantica worms. Nowadays, we have to be very concerned to the slaughterhouses and stay 2-3 days to find some positive cases. This is the status of this infection in these days. So, Fastidiosis hepatica and Fastidiosis gigantica. Operculum at one pole. Operculum in the egg, you can see that it is a door when the eggs reaches the water environment. It will be open and the embryo, we call as miracidium, can go out. Okay, life cycle. This is a very useful sentence for me as physicians and as in the future, and also for other people who are interested to think about health matters. By looking at the picture of life cycle of each parasite, you can understand some important points without reading books. Okay. What is the source of infection? What is the appearance, morphologically, I mean, the parasite? What is the pathogenesis? What is the locations in internal organs of the host that this parasite can inhibit? What is the route of measures for controlling infection? All of these very important matters are in this picture for each parasite. Okay, this is the life cycle of Fastidiosis hepatica, liver fluke. You can see that the adult worms are in biliary tracts, in gallbladder. For cattle, for herbivores, this is very easy. Eggs comes out from the feces into the environment, and in agricultural system, in classical agriculture, they use that as fertilizer and go to the, I don't know, fields, agricultural fields. And also, if the place and the region is in a dry area, if not so dry but not very access to the water stand area and rivers and canals and something, the chains of the transmission is cut, because you have to look intermediate host, invertebrate intermediate host as freshwater snails. So when the eggs are into water stand and concerning the opercle after 2-3 days, and also nearly, for instance, 1 week, the embryo become ground and the opercle become open, and the miracidia is go out. Miracidia is in water environment to reach the freshwater snakes. Freshwater snakes called limnae truncatula. Limnae truncatula. Inside the limnae truncatula, we have some developmental stages, asexual developmental stages, as sporocysts ready, and then after they change to cercaria, and cercaria release from the snail into the water environment, and then after they swim over there to attach plant and all materials that can be accessed to cercaria, and they, for instance, the plants over there, they attach to the surface of the plants, and they become encysted, called metacercaria. Metacercaria is the infective stage of the parasite. Through ingestion of metacercaria, the infection can transmit to new individuals. This is very important. Okay, so after that, the metacercaria for grazing animals, for cattle, for sheep, it's very easy. They go around and they eat plenty of these plants, including the metacercaria, and the infection is transmitted very easy. So this is important. But for human cases, in terms of zoonotic, it means that
raw uncooked meat.
No. I'm not talking about meat. I'm talking about raw vegetables. Raw vegetables.
No, from the animals to human.
This is the right. So pay attention to the life cycle, and then after I will again ask the points. Okay? No, the worms are inhibiting in the liver system, in the gallbladder of all final hosts, mainly animals, herbivores, cattle, sheep. Eggs go out through the feces. Eggs inside the water. Eggs get access to the snail, freshwater snail, inside the freshwater snail. Some developmental stage happen, and then after we have cercaria. Cercaria attached to the vegetables around the water become metacercaria. Metacercaria is the root of infection transmission to humans and other animals as well. So for this, you have to know that if you go to northern part of Iran, if you go to some places and you are looking for very nice vegetables, very even very tasty one, you can find, and I will show you in the pictures that, okay, you don't know whether these materials are included, are infected with the metacercaria or not. Washing the vegetables are not so useful, are not so effective. You have to avoid eating raw vegetables in places that are highlighted in the picture of fascioliasis. Anyhow, this is very important. After that, when you get this vegetable, raw vegetable, the metacercaria in the digestive tract In the beginning of the small intestine, they become detached, they become open, and the cercaria again try to penetrate the intestinal wall to access the abdominal cavity, and then after crawling to access to the Bowman capsule liver and try to enter into the parenchyma of the liver. So invasion is very important. And now here you may have, for instance, a scenario that will start with eosinophilia because you have tissue invasion here, and these very small babies, these very small parasites try to penetrate the liver and to access biliary tract and gallbladder. Okay. And then after they become adult, and again eggs are released into the intestine, and then after eggs to exit the life cycle. For human and animal, all the procedure is same. So this is just to show you what is the life cycle. By this life cycle, even now, if I ask you what is the measures for control fascioliasis, okay, you can see that. Up to now, even without continuing the class, if I ask you what is the pathogenesis process, you can see, you can mention this part. And if I ask you if this worm is living in gallbladder and bile ducts, okay, what will happen to the patients, you can guess. So this is why I emphasize on the importance of life cycle and showing the picture.
Is it fatal for the human? Fatal?
Yes, if it's not treated, and if in bile duct abstraction happened, if in very serious one, yes, why not? But otherwise, when you find the patient and treatment is carried out, okay, no. Anyhow, for instance, liver cirrhotic process, it's very important for chronic phase, I think. Fascicular hepatica, very important. Common name, the sheep liver fluke habitat, bile duct of liver, route of infection, man, it's aquatic plants with encysted metacercaria. Definitive host, usual host sheep, infect liver of various mammals, including humans. Intermediate host, freshwater states, limnate truncatula, I told you, and infective stage, encysted metacercaria. Diagnostic stage, eggs in the stool specimen, and disease is fascioliasis. Look at limnate truncatula here, amphibious land and water one, okay, nearly 1 centimeter in length, in size. So you can guess that this is very important. You are going to a very nice landscape, and you can see the picnic area, and there are not something very huge to look at. So you can find it through the vegetables over there. This is intermediate host, and in intermediate host, you have just ready sporocyst and cercaria, and then after for final host, you can see the adult fasciola. This is the map of Iran, and I decided to show you the very endemic area in Iran that we witnessed during three decades ago till now. Gilan province, Mazandaran province, and we can find it in some other places, but very sporadically. Why we cannot find it here? Desert area. In Yazd, for instance, in Kerman, the risk of infection transmission is very low because there are not plenty of rivers, water stands, no.
Right.
Yes, not so dry, but for instance in Kish Island, you cannot find it. Why? Because you are facing to the salty water. You cannot find here fresh water. Anyhow, so this is an important case, And you can find it in Kermanshah, for instance, in some places like Isfahan and Goristan, we can find. Like this appearance, like this estimation, you can imagine in your country, for instance. In Iraq, definitely I can say that in what cities the infection is a risk. In India, in Pakistan, I remember one of the colleagues, Pakistani physician was in Iran nearly 20 years ago. We were talking about the case of these infections, and she told me, and her husband told me that you cannot imagine they mentioned to some villages area of Pakistan, I don't know what was the place, and they told me that you cannot imagine how the number of cases we were facing 5 years ago, nearly 25 years ago. In India as well. But in Iraq, I'm just concerned for schistosomiasis, which is the next parasite in the next session, I will tell you. Anyhow, this is the apparent status of fasciitis in Iran and in other neighboring countries. Have you ever been in north of Iran? You?
Yeah.
Please, which one? Which city? Rasht. You?
Mazindaran.
You?
Rasht.
Rasht. This is from Rasht. This is from Rasht. Very delicious one. Zeytun parmakte. Okay, zeytun, very delicious one. No, this is pasteurized. This is not natural one. This is not organic one. When we say not organic one, you have to avoid to get infection, because when you say organic, it means that it's white nature and everything is natural. So you can see on the right that these very nice vegetables, edible vegetables, very useful one and very nice one. They may infected with the metacercaria. So you go to the bazaar in Rash or somewhere, and maybe you may buy them very expensive, but anyhow you want to get fasciitis for that. My friends in Rash and in Bandar Anzali, parasitologist Dr. Ashrafi, for instance, the professor of parasitology in Rash University, they decided to design a garden near their house to cultivate these materials free from fasciitis. And salty material and also sirke or something like that is not important to kill the metacercaria. So this is very important. And this is why I tell you that if you go to endemic area and you may order a very delicious raw material for lunch or for other occasions, you have to be very conscious about it. So this is Gilan province and Bazaar. If you go there, the poor people cannot buy this, but because we are looking for organic materials. This is very expensive, and they are transmitting metacercaria to humans. Pathogenicity and symptoms, 50% asymptomatic. Disease may appear anywhere from a few days to several years after ingestion, after infection. What does it mean? It means that history is very important for asking from the patient, okay, when you are here with eosinophilia, this painful part of right abdomen here, and I don't know, restlessness and fever or something. Have you been ever in Rash? Have you been ever in Gilan or in other places in northern Iran? No. But don't forget, maybe they went to the bazaar in Kish Island and they buy something that is back from northern Iran. So the history must be very asked in details, and how many years since which time till now you have such signs and symptoms. Okay, eosinophilia is present with all infections at all stages and can be used as a diagnostic factor in ectopic and early stage infections when eggs are not be present in the stool. Why? Because I told you that when the cercaria, metacercaria open and cercaria penetrates the intestinal wall and go to growling to reach the Bowman capsule and liver. Okay, when they penetrate the liver, they are not adult, so you cannot find the eggs on the parasites for patients. So just invasive action is happening in the liver, and eosinophilia is appear. Why eosinophilia can be seen in this phase of infection? Why? What is the cause of eosinophilia for these patients? Why? Because tissue invasion is happening. Tissue invasion is happening. So, for this, you have to be very conscious here. Acute phase, rarely seen in humans and occurs only when a large number of metacercaria are ingested at once. Okay? Why? Because for animals, the acute phase is very appealing. Why? Because the hundreds of metacercaria can be eaten and ingested during a day. But for humans, maybe just in one sandwich or in one course of travel to some places, you may get 2, 3, or some other metacercaria. 3 of them are, I don't know, are released into the intestine and they are get out, and one of them is just destroyed during the digestion, and 1 or 2 is capable to reach themselves to the biliary tracts. This is very important. Acute phase and fever, tender hepatomegaly, and abdominal pain are the most frequent symptoms of this stage of infection.
So weight loss? Weight loss?
What?
Weight loss?
Yes. This weight loss is a common sign of all parasitic infection, microbial infection, viral infection, and everything. This is not a very specific sign for such infection. You have to calculate, you have to see the pathogenesis, and you have to guess what exact effect of such agent can produce weight loss. This is not in this stuff. Vomiting, diarrhea, urticaria, and also anemia may be present, caused by the migration of the Fascida hepatica larvae throughout the liver parenchyma. The larvae penetrate the liver capsule, I told you, and produce symptoms 4 to 7 days after ingestion of metacercaria, and migration in acute phase continues for 6 to 8 weeks, okay? And also for chronic phase, more common in humans. Why? As your friend asked, this is very important to see that when the worms are inside the biliary duct and gallbladder, okay, and they are residing over there for years, and reinfection always may happen. After some years, maybe you are facing to blood loss, maybe you are facing to jaundice and something that is due to obstruction of bile duct, and more common in humans. Why chronic phase of this infection is not important in animals or in veterinary section? Why? Why? This is related to your IQ. This is not related to.
Because they eat a lot.
Because what?
Because they eat a lot, as I said. In the acute phase, they eat a lord and then they
No, the question is why chronic phase
yeah.
are important, is important in
Because
humans.
the infection occurs after
No. Why chronic phase is not so visible, detectable in animals? In general, I mean.
Is it because of their longer intestinal tract?
No,
No, it's because it's related to its immune system.
no,
because
because because the aging of human is nearly 70 to 80 years or 100 years, but the cow and the sheep, it just 2-3 years they go to the slaughterhouses. Have you seen a sheep with 100 years old? And or they never let them to be go older because they want to get money. Anyhow, okay, for in biliary colic, abdominal pain, tender hepatomegaly, and jaundice. Okay, in children, severe anemia, common result of infection, biliary obstruction and inflammation, and also fibrosis in liver, pyrostom liver, and also portal cirrhosis, which is very important in what you say, causing death maybe for. I will tell you a very nice branch of science that just recently, 10 years ago till now, we decided to perform in our department. After that, it is very important to mention some very neglected matters. Okay, that one is ectopic parasitology, ectopic parasites. The parasites are in places, in locations that is not normal and it's not their own location. They wandered over there. Maybe when they are looking for finding the liver into the crawling, they can go near the abdominal wall and also in the, under the skin, and you can see that. Dr. Darimi, one of my colleagues, recorded one ophthalmic fascioliasis, which was suddenly go to the I don't know, indirect route of their not natural manner and natural habitation. Halazone. He asked me that the route of infection transmission is by eating the meats and by internal organs of the animals. No, but there is just one risk, because the worms are inside the liver. If you ask your grandmothers, grandfathers in all of your countries, except in India, maybe you, or maybe in Kashmir, yes, you can ask them, have ever ate the raw liver of cattle or raw liver of sheep? Yes, when I was a child, for instance, my mother prescribed for good health to eat this liver raw when they slaughtered some sheep for aid or for something. When you go for kebab jigar in Iran, it's over there. Although they try to prepare healthy liver, but maybe you can find a very juvenile worms and this one into the liver, and if it is not well cooked and you ingest it, maybe in the pharyngeal area they can attach. This is not fascioliasis, it's just a mechanical disorder that can happen. They can attach themselves to the pharyngeal area and they produce halazone. Worm settles in the pharynx. Occur when an individual consumes infected raw liver. The young adult worms then attach themselves to the pharyngeal mucosa, causes considerable pain, edema. I witnessed one case when my friend, he is a physician in Damavand town, refer the patient to my laboratories. Ectopic infection through normal transmission are infrequent but can occur in the peritoneal cavity. I told you one of the colleagues recorded one case in terms of ophthalmic case. Detection of eggs in feces or aspirations of the duodenal fluid. According to parasitologists, the diagnosis, the confirmed diagnosis is just by looking the parasite particle, eggs, larvae, adult one. Although most of these infections are diagnosed by serological tests, PCR and some others, but according to realities, you have to look the parasite. Anyhow, for fascioliasis, a stool examination is the first choice, but why this stool examination is not well concerned and it is not well reliable means of diagnosis. Why? Fascioliasis.
Is
the larva too small?
Because you have two different phases of clinical and science, clinical systems. Before getting adult, after getting adult. Eggs in the stool is when the worms are adult, 2-3 months after that. Before that, the larvae and juvenile parasite is digging the parenchyma of the liver. Very, very dangerous and very painful appearance are over there, clinical signs and symptoms. But you cannot find the eggs of parasite. You have to go for ELISA test and you have to go for testing, for looking for antibodies against the antigen of the parasite. Multiple stool samples may be required to find the tray bottom eggs. Maybe at this time you can guess that the patient is facing to fascioliasis because eosinophilia and pain and tender of the liver part and some. And 2-3 months later, the laboratorian told you the case is fascioliasis by finding the eggs. But you cannot wait for 3 months to find the eggs of the parasite. Eggs may be passed in the stool following the ingestion of undercooked liver of infected sheep. This is another very, very important matter to be taken into your account. We go to the laboratory and the stool examination, and the result is, okay, fascioliasis. You are very healthy, no matter. Why? Because you ate kebab jigar last night or one day before, and you find just eggs that are belong to the worms of that sheep or that cattle. This is transitional infection, spurious infection. This is not real infection. So take into your account.
Doctor, when I make kebab, the eggs is not dyed?
What?
Eggs.
In kebab?
Yes.
In meat you mean? No,
Yes.
No. This is for liver just.
And cooked meat, cooked meat.
No, uncooked or cooked. You prepared dishes of jigar, for instance. Eggs are over there. Eggs are over there, and you are eating them. Morphologically, you can find the eggs over there. They are dead ones. They are not belong to your parasite. They are belong to the parasite of that sheep that is killed, and you are eating.
So they are not
No, transitional ones, and you can call them as a spurious infection. A spurious infection.
MashaAllah.
The definitive and most widely used for diagnosis is stool sample, the duodenal aspiration, and also ELISA or fast ELISA test. This serological examination can detect the infection when the worms are still young and they are not adult. Okay, CT scan, ultrasound also can be effective for treatment I told you triclabandazole. I mentioned to praziquantel. Praziquantel, forget praziquantel, please, if I told about praziquantel. Where I told you that Fansidar was the veterinary drug used on that time, and the main combination, main material of Fansidar was something that is used for triclabandazole. Triclabandazole nowadays in every part of the world is the drug of choice. I remember that I received 100 doses of triclabandazole nearly 10 years ago from WHO. And as long as we kept this drug in our School of Public Health, just 5 or 6 patients came to us for this treatment, but they are now in my, I don't know, that's it. So, triclabandazole, 98%, 10 mg per kg, single dose. And also, misadoxagrino, the drug of choice is just triclabandazole. Okay, what is it? Fasciola, this is the latest paper we published. Fasciola infection unexpectedly found during cholecystectomy. Review on how to avoid increasing surgery interventions in non-human endemic areas. I told you this, endemic areas are places with water stands, with rivers. We found in some places in southern part of Khorasan province, and the surgeon found something in the cholecystectomy. They sent that to us, and we found that the parasite is Fasciola. It was very, very important for us, and we decided to look for other cases reported in every country with a similar appearance, and we found that maybe this worm can stay in gallbladder and get some material around for years and become stone over there. So we get a stone over there. This is also very important, but you have to be very conscious when some surgeons are prescribing surgery or cholecystectomy. Enough laboratory tests be conducted. This is very important before starting for surgery. I promised to talk about a very interesting and very personal, interested matter of mine that we started 10 years ago in School of Public Health, called Paleoparasitology, looking for parasite of ancient. Fasciolae patica eggs in paleophases of a Persian onager, Equus henius or onager, a donkey from Chehrabad archaeological site, Sassanid Empire, 224 after Christian, nearly 2,000 years ago. We found that in this section of study, we try to make connection with archaeologists when they excavate archaeological site, and they find the biological remain like pieces of that time. We say coprolite or the cadaver of the skeleton of animal. We decide to get all materials attached to the bone of the pelvic area, and also for the paleophyses. We detect them, and if they are infected, we can find that this individual was infected for some years ago. And for instance, in some other parasitic infections like hydrosis, for instance, one French archaeologists sent me something excavated in northern Paris, and we diagnosed as hydatidosis in Middle East, in Middle Ages over there, and also fascioliasis found 2,000 years ago in one donkey. This is very important, dating back to the 2,000 years ago. This is why I told you that these parasitic infections, when you look at the picture of the parasite of the life cycle, you can see that source of infection. What is the source of infection? The transmission is very normal over the years, and maybe by global change and something that's changed the environment, temperature, and water stand area. For instance, in some places that it was deserted area, millions of years ago, sea and rivers were calm over there, and you can compare the changing of environmental situation. Okay. For control, let me tell me that what is the control measure for fascioliasis?
As you said, the wet place is the more, and if we break down the chain of transfer, we have to dry.
So you have to look for, when you go to some places like this, you see the cattle, you see the grasslands, you see water. Okay, this is the place to be careful about this parasitic infection. Okay, the first one is that you have to look for this, and you have to tell to people who are living over there that be conscious about this possibility. Okay. The another measure is to let them know that raw vegetable is very important, and they are the source of infection. Controlling the freshwater snails also is another one, and the main important one.
Not to use the feces of like cows.
Exactly. And because nowadays the chemical fertilizer are so prevalent and they are common for all villagers, okay? So this is something that can happen accidentally, because cows are going everywhere. When you go in these places, cows are freeing over the places, and maybe feces and everything containing of the eggs are available. But when the feces is here near the very dry place, okay, snakes are not aware, so it is cut. Okay, that's all. Snake control, chemotherapy. Why chemotherapy for animal and human is important? Why? Why chemotherapy is a means of control infection?
Do you mean like, do you mean by chemotherapy like for the environment, like filtration of the water, like?
No. Why chemotherapy and mass chemotherapy among humans and among cattle and among sheep is a very effective means of control? Why?
Because it destroys the parasites in the eggs.
Yeah.
Destroys the parasites and the eggs, the chemotherapy.
Why, please?
The chemotherapy destroys the
Yes,
parasites.
because the source of infection, you are targeting the source of infection. If cattle and sheep become treated, okay, there is no any worms to lay eggs, to reach the water, to form metacercalia, to ingest the raw vegetables transmitting infection.
What if we sterilize the water? Sterilization of the water.
Yes, this is not very easy. Okay, this is my order. Sterilize all the water. You can say, okay, yes. This is just one. You cannot say such matter to governments. Governments are looking for their matters. Oh, okay. The government of Iraq, Iran, India, Pakistan, Autriche, I don't know, Poland or everywhere, or South America, please, from now on, sterilize all the water. And
No, I mean the drunk one.
drunk water, drinking water is something very important. Yes, I didn't focus on the drinking water as a source of infection. For animal, yes. And in very accidental cases, maybe when plenty of metacercaria are attached on the surface of the raw vegetables, and you are looking for getting water from that area, and yes, it could be. But nobody drink water like cows, for instance, near the rivers. Anyhow, for animals, yes, it could be. But it depends on the endemicity and the number of metacercaria available for them. Okay, the next one. It was fasciitis. Finished. The other liver fluke, the other trauma, is Dicrosolium dendriticum. Again, this parasite is zoonotic, common between humans and animals. Again, snails are intermediate hosts, but specifically in this infection, we have two intermediate hosts, two invertebrate intermediate hosts. One is snail, but not freshwater snail, terrestrial snail.
Can we have a break for 5 minutes?
What?
Can we have a break for 5 minutes?
After this, yes. After this, for half an hour and more, 1 hour.
Okay, for 1 hour.
After this, for 1 hour, you are free.
Okay.
Okay. But not now, because I may forgot these things.
Okay.
So, two intermediate hosts. Okay, yes, 10 minutes.
No.
10 minutes rest.
Thank you so much.
10 minutes rest.
علي مدتها 65
So
دقيقة.